Okay, so I've looked at the patients and I think I'm gonna go and see. I think I'll go see Jessica first.
Okay.
Okay. So, hi, Jessica.
Yeah, hi.
Hi. How are you today? How are you feeling?
Oh, I'm doing okay,
Okay.
considering everything.
Yeah, you've had quite a time. Okay, so I'm gonna be your nurse today, and I'm gonna just start off and get a few vital signs and do an assessment, if that sounds good.
That works for me.
Okay.
You're the boss today.
Okay. So are you having any pain right now?
No, I don't really have any pain. You know, I mean, I can't really feel anything below my belly button.
Right. Okay. Well, I'm gonna get your vital signs now. So I'm gonna get her blood pressure.
So her blood pressure is 85/50.
Okay. And her heart rate?
Heart rate is 75.
And her respirations?
Respirations are 16.
Okay. And her temperature?
Her temperature is 98.7.
Okay. Okay, so okay, good. So I'm gonna do a little assessment here. I'm gonna do a neurological assessment. So can you stick out your tongue for me?
And the patient sticks out her tongue just fine.
Great. And then, I don't have a pen light, but I check her pupils.
Okay.
So
what are you looking for with the pupils?
Just to see if they're equal.
Okay.
Yeah.
So the pupils are equal.
Okay. And then I'm gonna have her squeeze my hands.
And she squeezes your hands, and the grip is equal on bilaterally.
Okay. And then I'm gonna have her push against my hands with her feet.
Well, I can't really do that because I can't feel my legs.
Oh, that's right. I'm sorry. Okay. So, okay. So I think what I'll do, Jessica, is I'm just gonna go check on my other patient and see if you have any meds, and then I'll be back.
Okay, that sounds like a plan.
Okay. Can I get you anything?
I'm okay right now.
Okay. Great. So I'm just gonna check the chart.
Okay, you can do that. The chart is on the other computer.
Oh.
That's the med machine.
Okay. So I'm gonna just check that and see if I have any meds to give. I don't think I do. Feel like she needed a blood sugar, but I don't see it on here. So I'll go see my other patient, and then I can go back and forth, right?
Mm-hmm.
Okay. So Hi, are you Jose?
I'm Jose.
Hi, Jose. My name is Bree. I'll be your nurse today.
Hi, Bree.
So how are you doing?
I'm doing okay, I suppose.
Okay. Are you having any pain at all?
Yeah, I'm having quite a bit of, oh man, I'm having quite a bit of pain right now. Oh.
Okay. Well, it looks like you just had your IV pain medicine, so maybe we can do some deep breathing.
Oh man, well it's even hard to breathe normally. I don't know if I can take a deep breath like that.
Okay, well maybe you could do some visualization. Is there a nice place that you like to visit? Or?
Well, I like to go golfing, but that doesn't, oh man, that doesn't sound very good right now.
Okay, all right. Are you feeling nauseous at all?
A little bit, but not too bad.
Okay. All right, so maybe I can get you some toast later if you're not feeling too nauseous.
Okay, we can see how that goes.
Okay, good. So I'm just going to get your vital signs, and then I'm going to do a little assessment, okay?
All right.
Okay, so his vital signs?
What vital signs would you like?
Oh, his blood pressure?
His blood pressure is 110/80.
Okay. And his heart rate?
His heart rate is 90.
And his respirations.
They're 22.
Okay, and his temperature.
His temperature's 98.
Okay. Okay, so the heart rate's a little fast and the respiration. So, but I'm gonna, because he has the pancreatitis, I'm gonna do an abdominal assessment.
Okay.
Okay. So, but he already said. Okay, so he's in pain, but he's not nauseous, so that's good. So I'm just gonna listen to your bowel sounds, Jose. Okay.
Okay.
I'm gonna pull up your gown here. So, okay. So I'm gonna listen first. So I'm listening in all 4 quadrants.
Okay, and they're hypoactive in all 4 quadrants.
Okay. I can't remember if that's normal or not. Okay. Okay, and any pain when I
Oh man, oh, that's so
I'm
sore.
sorry. I'm so sorry.
Oh, the pain is so bad.
Okay. I'm so sorry, Jose. You know, I will check and see when your pain medication is due, but I know you just got some, so I'm not sure.
I really feel like we need to do something about this pain.
Okay, all right. Well, I'll see what I can do, and maybe I'll get you some toast too. So I'm gonna go and check on your meds and a couple other things, and then I'll come back.
Okay.
Okay. All right. So I'm gonna just check the chart. Over here. Is there? Because I feel like I'm done. I mean, is there anything else I'm supposed to be doing?
You'd have to check the chart, see if anything's due.
Okay. Just look here. Yeah. I mean, he's had his meds and yeah, I think I saw something in the chart. Oh, right, there is an injection. That's right. Okay, so I'll go talk for Jessica. I've got to give her some Lovenox.
Okay.
So, okay, so I'll go back in. Jessica? Jessica?
Yeah?
Hi. It's your nurse again. So I have to give you an injection of Lovenox. I think you've been getting it here.
What is that for?
It's for bleeding. So because you have some bleeding, we're giving you the Lovenox.
I have some bleeding.
Well, you know, from your accident. So I'm gonna get that, but it'll help with the bleeding too.
Okay.
So I'm gonna go get that, and I'm gonna give it to you in your arm, okay, right here, and I'll give it a little massage after, so it does sting a little bit, but I'll go do that, okay?
Okay.
All right. So here's my med. This is the med cart.
Yep.
Okay. So Lovenox, 100 milligrams. Yeah. Okay. All right. So okay. All right. Okay, so I'm gonna get the Lovenox. It's in one of these bins here. Oh, here we go. Well, this is heparin, which is kind of the same thing. So I don't see it. Oh, here we go. I use one of these little ones, right?
And you don't actually have to fill up the syringe or anything.
Oh, okay.
I just want you to tell me what you would, the motions, think out loud, so tell me what you're doing.
So well, I didn't see any Lovenox, so I thought I would just give the heparin, because it's a heparin family. So, but this is 20,000 units, and you're supposed to be getting 100, so I don't really know how to do that. So, I mean, it looked like in the mLs, it was like 2 mLs, so I'm just going to draw up 2 mLs. Okay?
Okay.
All right, so, okay, so I drew up 2 mLs and I scrubbed the thing, and, okay? All right, so.
Yep, just go through the steps with me and let me know what you're doing.
Okay.
What you would do.
So, Jessica?
Yeah.
Hi, it's your nurse again. So I have that shot for you, okay? It's gonna sting a little, okay? So I'm gonna clean off the site, and then I'm gonna give it right here in her muscle,
Okay.
okay? Going in at a 90-degree angle. Okay, so, oh, sorry, I know that hurts.
Really, that was stinging quite a bit.
Yeah. Okay, well, okay, can I get you anything else while I'm in here?
No, I'm okay. I kind of have a little bit of a headache. Maybe I just need to be quiet for a little while.
Yeah, I don't think you have any Tylenol ordered, so maybe you could do some visualization.
Some visualization?
Yeah, you know, put yourself in a happy place kind of thing.
Okay.
That can help with the headache, but I'll turn off the lights too. Sometimes that can help with the headache too.
Okay.
Or would you like a drink of water?
Sure, maybe some water.
Okay. All right, I'll be back in a while.
Okay, thank you.
Okay, so I'll just put this right here, and I'll go check on Jose. Hi, Jose.
Yeah, hi.
Hi, it's your nurse again. I'm just checking in on you to see how you're doing.
Oh man, I tell you, my pain is just really bad.
Yeah, I'm so sorry about that. You know what? I meant to get you some water, so let me do that, and then I'll be back, okay?
Okay.
All right. So I'm gonna get him some water.
Okay.
So I'll just pretend that I got him some water.
All right.
Okay. Okay, so here's some water, Jose. You can have a little sip.
Okay, thanks. I didn't know I could drink anything.
Yeah, yep, just a little bit. Just don't go overboard because you've been nauseous, okay?
Yeah, that nausea's still there, but man, this pain is just really bad.
Yeah. Well, you know, I'll let the oncoming nurse know so that when it's time for you to get your pain meds again, you can get them, okay?
Okay, even though it's like a 7 out of 10 right now?
Yeah, you know, I mean, they're only ordered when they're ordered, so there's not much I can do. My hands are tied, I'm sorry.
Okay.
All right. So anyway, your call bell is right here. So maybe you can watch some TV and that'll help distract you from the pain.
Maybe Jeopardy's on.
Yeah. Okay. All right. So I feel like I'm done.
Okay.
So I'll what's the next? Oh, I have to give a report.
You have to
right?
give report to the next student.
Okay. So let me get my sheet. Okay. That was really pretty easy.
Okay. Well, I'll have our next student come on in.
Okay. Oops. Hi Kayla, how are you?
Good, how are you, Dree?
Good. How was your weekend?
Oh, not long enough.
This is a breeze. You'll be fine.
Okay, perfect.
Okay, Kayla, so you have available to you all of these forms, and I'll go over that in a little more detail once you're done with the report. But here is your organizational plan, where you're used to using that, so you can take report on that. And then we'll go from there.
Okay. Okay. So you have two patients. Your first one is Jessica Smith. She's 45 years old. She has a spinal cord injury. And her vital signs were pretty normal. No problems there. And she's not getting any IV fluids. She does have an IV in her right arm. She's not in any pain. Oh, I forgot to check her bowel sounds, but they're probably fine. Doesn't have any, oh, I told you she doesn't have any pain. What else about her? I gave her some Lovenox.
Do you know how much and where?
100 milligrams in her arm, her right arm.
What time?
Just now, like 5 minutes ago.
Okay.
Yeah. So, and she's having surgery tomorrow.
What is she having surgery on?
I think they're going to do something with her, her fracture in her back. So, okay.
Okay.
And then this is Jose Garcia over here. He's a 57-year-old male with pancreatitis. He's had a lot of pain, but he had already had Dilaudid, so I couldn't give him anything else for his pain. And he's kind of nauseous, but he'd already had Zofran. So his pulse was a little fast at 90. and his respirations were 22, but everything else was good. And then I told you he was nauseous, he's having a lot of pain.
Do you know when you got the last doses of Dilaudid or hydromorphone and
I think like an hour ago.
Okay, both of
Yeah,
them?
Both of them. Yeah, it was before I started, so, and then, what else about him? He has bowel sounds in all 4 quadrants, so. Yeah, and he has an IV too. I forgot what it's running at, but it's in his left arm.
Do you know what our plan is for him?
No, I don't. I think they're just monitoring him for now. So. Okay.
Okay.
Thank you.
Thanks.
Thanks, Jenny.